Today I'll be talking about a common condition around the shoulder, what we all call as frozen shoulder. Frozen shoulder is a layman's term. In reality, it is the scientific name is what we call as periarthritis of the shoulder. As the name suggests, it is periarthritis. The problem is not in the bone, but it is in the structures around the joint. What happens in a frozen shoulder is the structures around the joint, the ligaments, the muscles, the capsule becomes very tight, inflamed, and so the mobility of the shoulder is seriously compromised. It is more common in females in the age group of 40 to 60, more common in patients with diabetes, in patients having thyroid disorders. It doesn't mean that it does not affect the others. It can still happen in the other population, but these are situations where it is a little more common. Now what happens, as I said, is a lot of pain in the shoulder and loss of mobility. Patients are not able to move the shoulder. They are in serious pain, difficulty during night times. Night pain is very characteristic. And how do we diagnose a frozen shoulder? The primary means of diagnosing a frozen shoulder is with clinical examination. The role of investigation in the diagnosis of frozen shoulder is practically nil. It is mostly a clinical examination and diagnosis. Now, most frozen shoulders are self-limiting. That's the good part. That means it does get better with time. There might be a period where it might take 6 months to 1 year also in a diabetic, but most frozen shoulders do get better with time. They start with pain, go on to stiffness, and gradually over a period of time, the stiffness reduces, the pain reduces. The treatment of a frozen shoulder is primarily conservative, that is non-operative. Mostly with medications, some amount of physiotherapy, and sometimes if the pain is too hard to bear with, we do give some injections to the shoulder to reduce the pain. It might need 1 or 2 injections sometimes, and very rarely, in less than 10% of the situations in a frozen shoulder, we may have to intervene in the form of sometimes manipulation, sometimes arthroscopic capsular release, and as I said, that's a very, very small segment of patients with frozen shoulder. So in just frozen shoulder is a common painful condition in the shoulder which happens in the middle age group. It is not in the young, it is not in the elderly, it is in the middle age group, and then causes a lot of disability. And the good part is majority of the times it does get better with time, and treatment is primarily non-operative with medications and physiotherapy. Thank you.